Hello friends, this is Tembikile again. Today we're going to talk about the intervertebral disc. The intervertebral disc, the structure of the intervertebral disc, condition associated with intervertebral disc, and the functions of the intervertebral disc. Again, I have my picture here from FNETAS. We will mainly use the lumbar vertebra because disc herniation are more common in the lumbar vertebra. So it is prudent for us to use the lumbar vertebra. Just a quick orientation to the structure of the lumbar vertebra. As we can see here, since we know that we have the cervical vertebra, 7 of the cervical vertebra, 12 of the thoracic vertebra, and 5 of the lumbar. Therefore, this is L1, L2, L3, L4, L5. And between L1 and L2 is the intervertebral disc, is L1 intervertebral disc. Intervertebral disc is always named by the vertebra on top of it. The one on top of it is the one that conquers that intervertebral disc. Therefore, this is L1 vertebra and L1 intervertebral disc. Or if you speak about the motion segment, what is the motion segment? A motion segment is 2 vertebra and the disc in between. Therefore, L1 and L2 and the disc in between, they are called the motion segment. Right. If we can just quickly identify the structures of the lumbar vertebra, we can quickly see this is the body, and next to the body is the pedicle. Then we have superior and inferior articular processes. On the superior processes, we have a structure called mammillary process. It's just a bulge for muscle attachment. And we have transverse processes. On the transverse processes, but we can't see it here, we also have a structure that is called accessory process. Then from there, we have a spinous process. How will you differentiate from cervical, thoracic, or lumbar vertebra? Mainly the lumbar is big, and then the spinous process is more horizontal, is in the same level like the body. As you can see, if you can palpate here and then you move backward, you can still find the spinous process in the same level like the body. Then we have the inferior vertebral notch, superior vertebral notch that make the intervertebral foramen for the spinal nerve. Spinal nerve are situated here. Right. If we can look at the posterior aspect of the lumbar vertebra, we can clearly see the vertebral body there, and then we can see the vertebral canal for the cauda equina, because we don't actually have a spinal cord in the lumbar vertebra. It ends somewhere between L1 and L2. The conus medullaris around this area. So below there, we have what we call the cauda equina, covered by a dura mater. So we have superior and we have inferior articular processes, we have transverse processes, we have mammillary processes. As I said, on the transverse processes, we have accessory process. The mammillary process and accessory process is more for muscle attachment. We will have a separate discussion on muscle of the back. Right. So the joint that we are dealing with here is an intervertebral joint. We will focus mainly on the on the intervertebral joint. We also have facet joints. Facet joint is made of inferior and superior articular processes. Then we have facet joint. Right. But our main topic for today is intervertebral disc. Intervertebral disc. Right. Intervertebral disc is also called the intervertebral ligament. It's one of the 3 intervertebral ligaments. Remember, here anteriorly we have anterior longitudinal ligament, and behind we have posterior longitudinal ligament, and then between the bodies we have the intervertebral disc. Specifically, is called the intervertebral, is also called intervertebral ligament because of one of its part called the annulus fibrosus. Annulus fibrosus is part of the intervertebral disc. If you can look at the intervertebral disc here, the outer part is called annulus fibrosus. The inner part is called nucleus pulposus. Right. The outer part, it's a ligament that connects vertebra to vertebra. That's why it's also called intervertebral ligament. Right. The intervertebral disc is made of 2 main parts, as I've said. The nucleus pulposus and the annulus fibrosus. This annulus fibrosus, if we can further analyze it, is made of belt-like structures that surrounds the nucleus pulposus. Those belt-like structures are called lamellae of the annulus fibrosus. Right. Let's first analyze the nucleus pulposus thoroughly. Nucleus pulposus is in the center, or is the center of the intervertebral disc. Is the center of the intervertebral disc. And this nucleus pulposus, this watery structure called nucleus pulposus, is held in place or surrounded by the lamellae of the annulus fibrosus. Is surrounded by the lamellae of the annulus fibrosus. Right. Its cells of the nucleus pulposus make a gene cells called glycoaminoglycans. These glycoaminoglycans, they form a structure called proteoglycans, which are extremely hydrophilic. What do I mean by extremely hydrophilic? These gags make proteoglycans. These proteoglycans are hydrophilic, which means they love water. They love water. That's why now the nucleus pulposus, its water content is normally 80%. Right. Since this nucleus pulposus can't escape the center because it's corralled by the lamellae of the annulus fibrosus, and the water is incompressible. Therefore, the weight of the body or the axial load turns this watery nucleus into a hard ball bearing-like structure. We have this watery nucleus pulposus that is caroled by the annulus fibrosus. It can't escape the center of the intervertebral disc because it's kept in place by the annulus fibrosus. Therefore, the weight of the body compresses this nucleus pulposus into a hard ball bearing-like structure. And this hard ball bearing-like structure acts as the pivot point for all trunk motions. Right. We are able to turn, we are able to make side flexion, extension, rotation because of this structure. But if we get what we call something we call the radial annular tear, when these lamellae breaks, it will screw up this system. Therefore, the pivot point will shift from this hard ball-like structure into the posterior part. That is the facet, the posterior part of the annulus and the facet. Right. This full thickness annular tear shifts the axial load from the nucleus, where it's supposed to be, to the posterior disc and the facet joints, and that can cause a premature degeneration of the facet joints. Therefore, the annular tear or the radial annular tear is normally called the root of all evil because it's a main cause for disc herniation, it's a main cause for degeneration of the facet joints. Okay, let's further analyze this nucleus pulposus. Embryologically speaking, the nucleus pulposus is coming from the remnants of the structure called the notochord. It is known as the only thing in the body that is normally derived from the notochord. Notochord also causes a nasty tumor called chordoma. There is a nasty tumor called chordoma. Chordoma is a tumor that is from the notochord, is an abnormal structure that is from a notochord. But the nucleus pulposus is also from notochord. And the notochord can also cause a nasty tumor called chordoma. Right. So when we look at the nucleus pulposus and annulus fibrosus, we realize that this structure is completely avascular. Is completely avascular and is non-innervated. When we look at this intervertebral disc, nucleus pulposus and annulus fibrosus, there is no blood vessels there. It's not innervated. Therefore, you can't feel a pain that is here. Only the quarter of the annulus fibrosus that is vascularized and innervated. The inner part of the annulus fibrosus and the nucleus pulposus is completely avascular and non-innervated. Therefore, it is very tough for this cell to survive. We will have to go in detail and understand how do they survive, because there's no food. If there is no blood vessel, there's no food. And how do they remove their waste? So it is easy for these native nucleus pulposus cells to die off. So when they die, their death will start to dehydrate or dry out the nucleus and the inner annulus. Therefore, this dehydrated disc tissue becomes brittle and prone to ripping. That's why we get what we call the radial annular tears, is because of that. This condition is called degenerative disc disease. When these cells die, they will cause a condition called degenerative disc disease. Right. Degenerative disc disease can be categorized into 5 levels by a process called, or by a system called Ferment. A Ferment system is for degenerative disc disease. Therefore, we have 5 different levels of degenerative disc disease. But this Ferment system, you can only be able to see it if you can be able to analyze an MRI. Because grade 1, grade 2, grade 3 cannot be seen on a radiographic studies. You can't see it from an X-ray. Ferment, grade 1, grade 2, grade 3 of the degenerative disc disease, you can only analyze it using an MRI. From an X-ray, you can see grade 4 and grade 5. Why you can see grade 4 and grade 5? Because for grade 4, for Ferment, using Ferment system, grade 4, the disc height is affected, is slightly affected. So if you compare a disc that is on grade 4, you can see the difference in disc height. And then grade 5, there is a significant disc height difference. So when you look at your X-ray, the X-ray can only show you bones. Therefore, you won't see the disc. You won't see the posterior anterior longitudinal ligament. You won't see the joint capsule. You can only see the disc. I mean the disc space. So if the disc space, if L1, L2 disc space is different from L2, L3 disc space, therefore, this disc is already in a grade 3, I mean in grade 4 or grade 5 Ferment. grade 4, grade 5 degenerative disc disease. That can be categorized as grade 4 or grade 5 Femen system. Right, let's continue. Let's try now to analyze how do these cells of the nucleus pulposus and the inner part of the annulus fibrosus get their food, get their blood supply, and get fed. Since we say if the cells of the nucleus pulposus and the majority of the annulus fibrosus have no blood supply, then how do they stay alive or get their nutrient and oxygen? How do they remove their waste? Then the answer is diffusion. The answer is diffusion. Now, we need to follow up one of the theories that explain this diffusion. This theory is one of the theories is called diurnal change. Diurnal change is one of the theory of disc feeding. What it says, what the diurnal change theory says, it says diffusion of nutrients. And remember, we said the disc, the nucleus pulposus, and the inner part of the annulus fibrosus is avascular and is non-innervated, and there is no lymph vessel, there is nothing, right? But when we look at the body, when we study this motion segment, when we look at the body is highly vascularized and is innervated, highly vascularized. Therefore, this diurnal change, it says diffusion of nutrients into the disc is encouraged by diurnal change. What do I mean by diurnal change? During slumber or recumbency, or when you are lying at night, the pressure within the disc during the day, okay, let me start by explaining this pressure. During the day, we have a pressure here that we call it hydrostatic pressure. How is this hydrostatic pressure created? The axial load, or the load of your body, compresses the nucleus pulposus, and the nucleus pulposus cannot escape because is caroled or is kept in place by the lamellae of the annulus fibrosus. So the weight of the body creates this hydrostatic pressure, and this pressure is called the hydrostatic pressure. Why do we care about this hydrostatic pressure? Because we need to understand this process of diurnal change. Let's come to this diurnal change, right? So during the day, there is a high pressure here because of the weight of the body, and this watery substance called nucleus pulposus cannot escape because it's kept in place by the lamellae of the annulus fibrosus. So diurnal change, it says diffusion of nutrients into the disc is encouraged by diurnal change. During slumber or recumbency, or when you are lying at night, the pressure within the disc is negative. Therefore, this negative pressure creates a sucking force, because this part of the motion segment is highly vascularized. There is enough nutrients here, there is enough blood, everything is available here, but there is nothing here. But at night, when you are lying flat, there is a negative pressure within the disc, right? Because there is no hydrostatic pressure, because you are lying. So that negative pressure will create a sucking force, right? Let me start again. Let's explain this diffusion thoroughly, like feeding of the intervertebral disc. We say blood nutrients from the capillaries of the vertebral bony end plate diffuse or soak through little holes called marrow cavities. There is little holes here called marrow cavities, or you can call them marrow channels, in this structure called the subchondral bone of the bony end plate. Right. So we say this diffusion of nutrients into the disc is encouraged by a diurnal change, is encouraged by a negative pressure inside it, and this negative pressure creates a sucking force. Right. So the nutrients and everything at night will go into the disc and feed the cells. So during the day, you will stand up again, and then the hydrostatic pressure will be created. And then the nutrients and the necessary thing that went into the disc has been used up. What is left in there now is the waste. So when that pressure is created again, it will push the waste into the blood. So what can go wrong here? What can go wrong? This structure, we call it the vertebral body, and the disc is situated here. There is a little holes here, as I mentioned, called marrow cavities or marrow channels. What can go wrong? If these marrow channels may become closed up or non-functional, which cuts off the feeding system, which kills the cells of the nucleus pulposus and the inner part of the annulus fibrosus. So as they die, as these cells die because these openings are no longer functioning, the disc loses water content and collagen content and becomes dry and brittle. This disc, when it loses water content and the collagen content, it will become dry and brittle. And that we called the degenerative disc disease. And it will show up on an MRI. And it can be graded by a system called Feynman system. Feynman system can grade it from grade 1, grade 2, grade 3, and grade 4, and grade 5. Right. What is the difference between an X-ray, a CT scan, and MRI? Let me just do a brief definition between these. The X-ray, you can only see bones from your X-ray, and the X-ray cannot be sliced. Like the X-ray is just a picture of the bones. Right? The CT scan is also the picture of the bones, But the difference between X-ray and the CT scan is that the CT scan, you can do surgical cut. You can cut it. You can slice it through like this, or you can cut it this way. So you can do different cuts and see different parts using a cut. Same applies with an MRI. But the more advanced part of the MRI, you will be able to see bones, you will be able to see soft tissues. You'll be able to see spinal cord, you'll be able to see nerves, you'll be able to see all different parts of soft tissues, especially if you do what they call a T2 weighted image of an MRI. A T2 weighted image of an MRI is the one that shows watery structures as white. So if you take a T2 weighted image of the disc, a normal disc, you will see the T2 weighted image will be white at the center, and the solid part of the soft tissue will be a bit darker. Right. Let's continue. We said what can go wrong if these marrow cavities that allow nutrients to come into the intervertebral disc, to the nucleus pulposus and the inner part of the annulus fibrosus, become clogged or closed. That process will lead to the death of these structures, a process called degenerative disc disease that can be graded by a system called Ferment system. Therefore, if the degenerative disc disease affects this intervertebral disc, and then you use Ferment system, and then you see the disc height is, the height of the disc here is smaller in comparison to this. Therefore, if this one comes down, it becomes small, then there will be compression of this facet joint. Therefore, it will lead to the degeneration of this facet joint. Most of the time, facet joints are secondary problem from the intervertebral disc. The first thing is degeneration of the intervertebral disc. The second thing is annular tears. I want to say something about annular tear. I have a drawing that I've done here. This is a body of the intervertebral disc. This is also a body of the intervertebral.